It is hard to come across a person whose life has not been touched by a nurse. They are there at our birth. They are there for your wellness, illness, recovery, and loss. But how much do we know about these people who have become a vital part of some of the most difficult and yet critical moments in human experience?
A nurse is the first person who meets with a patient or a client in a facility.
Nurses are the backbone of any health facility.
We are there 24/7 for our patients and the clients. We play a very good role as far as health is concerned.
So what exactly does their role entail?
I think most of the people do not know what actually the nurses do.
Nursing is a noble profession. Nursing is a call. You really have to have that passion in order to deliver, in order to meet your desire of being a nurse.
There is usually a theatre nurse to receive the patient and the anesthetist. So you receive the patient together, you check if the patient has signed the consent, if the patient did what was supposed to be done correctly and is fit to come in.
The public has not yet understood who a nurse anesthetist is, because some take a nurse anesthetist as a theatre nurse. There is a difference between a theatre nurse and a nurse anesthetist, because a theatre nurse will handle the instruments and help in scribing with the surgeon, but the anesthetist is the one who makes the patient sleep and wake up the patient after the surgery is over.
What you need to know is that nursing specialties cut across board. We have nurse anesthetists, we have nurse midwives, we have nurse in ophthalmology, we have nurses who take care of you when you're undergoing dialysis, we have nurses trained in critical care. These among the many.
Nursing happens to be one of the world's most respected professions, with caring, knowledgeable professionals committed to quality care. However, most people don't realize that nurses, just like doctors and physicians, are nationally registered in their own nursing specialty.
We know that nurses have great potential of improving the healthcare system in this country and the world over by virtue of the work that they do. We have nurses in different specialties. Nurses who are educated from certificate level to PhD. That means that nurses as a career is capable of delivering quality nursing care to improve the quality of health of citizens in this country.
The registration exercise validates knowledge and expertise and promotes the professional excellence of nurses across the nation. They work throughout the healthcare system, hospitals, academic centers, clinics, physician offices, and in their own communities, from urban to rural and large to small.
In all the 47 counties, we have nursing workforce in all levels of healthcare, starting from level 2, that is the dispensaries, to the health centers, county referral hospitals, and even the major national referral hospitals.
The outreach is usually once per month, but we go the farthest because these are the people who are challenged. They are not able to come to the facility because of transport. Maybe funding is not easy for them, so we go there and give them the necessary services they are supposed to get.
Nasi ni muhimu kwa hospitali. Ni muhimu sana. Hao wanapenda kazi zao, wanafanya vizuri.
Manesi wanafanya kazi nzuri sana, na ni kwa sababu wako kule pale chini katika mahali tunaopatikana mashinani. Manasi, hakuna kazi inawezekana bila manasi.
Wanatibu vizuri, maana kutoka Ijumaa nilipoingia hapa si kama vile ndivyokuwa.
Such are the sentiments that reflect the many ways nurses impact lives. Even so, the profession continues to experience notable obstacles. And just to understand the great responsibility a Kenyan nurse bears in light of challenging circumstances, we visited various healthcare centers in Kwale County. At one of these facilities, the Kiboyoni Health Dispensary, we met Janet Okwara, a registered health nurse and the nursing officer in charge of the facility. On a weekly basis, She covers a significant distance from her home to provide care to those in need, staying at the dispensary throughout the week and returning to her family over the weekends.
I have to be away from my family for the whole week. So I report here on Monday, then I go back at my home on Friday. Doing that, keeping in mind that when I come here, I have to work day and night.
The queues outside her office keep growing while she tries to assign the patients according to urgency. Nurse Janet, who manages the entire facility single-handedly, is often forced to dig into her pockets in order to support patients who are unable to meet the cost of basics which the rural healthcare facility lacks.
I use my own money. And the money which you say that will be reimbursed, it comes, you don't know when it will come. So when you say that I'm waiting for the money, the client will have to suffer.
The situation gets worse when a patient has to be referred for emergency services.
If the mother is bleeding and you have called the ambulance, they are telling you you are coming 1 hour, 2 hours, 3 hours, you don't see any, and you cannot transfer this mother with any other means than an ambulance.
It is here at Msambweni County Referral Hospital, the only referral hospital in Kwale County where complicated cases are addressed. An average of 15 patients are admitted here every day. The mortality rate at the hospital is very high, close to 20% for some of the wards. The hospital also provides specialized palliative care to patients with chronic or life-ending illnesses. The palliative care unit is supported by the East African Women's League, situated in the South Coast. Despite Nurse Janet's hard work and dedication to her patients, she only manages to take home an equivalent of around $200 a month, an extremely low wage for a qualified nurse.
Doing all the work for all those people, plus the lab work, because the testing is the lab work. I'm doing all that. So compare with the workload you are doing and the hours you are working, it doesn't tally with the salary you get. You should have that heart of serving the patient. Then all the others will leave it to God.
Such strains and poor working conditions continue to take a toll not only on Nurse Janet, but also on the vast majority of nurses countrywide, leading to depression and imbalanced lives.
Because you can find in an hospital just one nurse.
We do a lot of things and most of the nurses are demoralized. They're not getting what they're supposed to be getting despite the workload, despite the work that they're doing.
We go an extra mile. Sometimes we leave our families. They suffer long hours without us.
Sometimes it's congested. We have a lot of babies. The incubators are less. The area is small for the babies. And then we have sometimes supplies. We don't have enough supplies for the babies and also for the mothers.
An adequate workforce is the other pressing issue that nurses have to grapple with on a day-to-day basis while executing their mandate. Most nurses described a mismatch between expected tasks and duties and the available human resource.
The biggest challenge that we have, not only in Kenya but the world over, is the critical shortage of this human resource that is nursing. We are grappling with shortage of staff, and statistics have shown that when we are having inadequate staff, it impacts on care negatively. The patient-nurse ratios that we are operating with as a country are way below the WHO standards.
The jobs of all the people, it is we are doing. So if the government can at least, we can just do only what we are supposed to do as a nurse, then they look on the side of the workforce, the human resource, they employ more people.
The issues of shortage, it has really hit us hard, because even releasing our staff to go and leave, it is really a challenge. Because now where do I source?
It's upon the government to raise the human resource, and then despite first raising the human resource, the working condition has to be favorable.
But why is human resources important in the healthcare sector?
Safe staffing saves lives. Where we have inadequate staff, then we have potentials for loss of life and complications occurring.
In spite of this, nurses in Kwale County continue to exhibit positive attitudes in their areas of designation, hence making immense contributions to the society. For instance, following lack of proper access to health information, the rural communities develop unhealthy behaviors that result in negative health outcomes such as chronic health conditions. To alleviate such problems, nurses have introduced educational forums in various primary healthcare facilities.
Normally give those the health education so that they can, all those danger signs, if they notice them, they report immediately so that we can take action. That's what we do.
Geographic access to healthcare has also been a challenge. For close to a decade now, long-distance travel has been a necessary component of receiving healthcare for the Kwale residents. This is mainly because the communities cover vast expanses of land. But a collaboration between the Kwale Nursing Fraternity and Best Titanium, a mining company based in Kwale, and in support of the county government quest to improve on health delivery, a potential solution was identified.
We've been able to facilitate or support putting up of various health institutions, including Magaoni Health Facility, which is just around the mine site. The facility was brought up mainly to make it accessible for healthcare services to the community members around, since the terrain, the distance from between the household, the nearby villages and the facility was quite a distance.
This remote health unit, which currently caters for approximately 60 patients a day, is however not the only success story on the county's healthcare scorecard. With an estimated HIV prevalence of 5.7%, according to national HIV estimates, Kwale County is ranked as a medium epidemic county. With 21,159 people living with HIV in the county, it is of concern that 2/3 of this population are women and over 2,600 of them are children. Nevertheless, the war against HIV ages on at several healthcare centers. Victoria Saidi is a Kenyan registered nurse and a trained midwife.
By then, the drugs there was a turnover of new drugs, and many mothers were getting affected by the side effects, and they could drop out, and even the monthly attendance, they could not manage.
But a group of women helped make it just a little bit easier for pregnant women and new mothers to live with the condition. These women form the core of the support group called the Mentor Mothers. The program was officially flagged off by the First Lady of the Kwale County, Her Excellency Christine Mvurya, and it is funded by the Best Titanium Mining Company.
The Mentor Mothers' mandate is to look for other mothers or mothers that have defaulted in HIV medication, or rather people who have defaulted from HIV care. So their mandate is to go down the community, look for them, and make sure that they bring them back to the services that they used to have.
At the health facilities, the mothers are provided with free HIV testing, counseling and treatment.
First, we do the health talks in the morning. We give the health messages, especially on the HIV transmission, the disclosure for those ones who are found positive.
Spending a day or two at the health facilities, a form of sisterhood is established and the women find a place of comfort and mutual understanding.
When they come here, you see the interaction is special. They laugh. It's a great day.
The goal of the Mentor Mothers program is to provide women, many of whom may have just learned of their HIV status, with a connection to someone who can provide assistance or insight as they navigate the obvious difficulties that come with living with the condition while caring or carrying a child. Almost all HIV positive women enrolled in the Mentor Mothers program in Kwale County give birth to HIV negative babies.
Currently we have 54 mothers, and I'm happy to say with them we we had a graduation of babies, 2 graduation now, one in 2016 and the other one we held it in last year, 2018.
In reference to the 2018 HIV Progress Report, Kenya had 69,497 pregnant women living with the virus. 3 in every 4 of them were duly on PMCT. This is to mean Prevention of Mother-to-Child Transmission Protocol. Unfortunately, 8,000 children were newly infected with the virus, making that 8% of the people living with HIV, a worrying trend that has so far compelled nurses in Kwale, the mental mother support groups, and key partners to work tirelessly to contain.
We find that most most clients don't come to facilities to be tested for HIV. So we take this advantage to let these mothers know that they are supposed to be tested for HIV, so that if they are positive, we give them the necessary treatment they are supposed to get, and if they are negative, we encourage them to continue staying negative, and also encourage them to bring their partners for the testing.
We work hand in hand with the county government, where we feel that there is an aspect, let's say family planning, that they need support. We normally come in to support.
Their efforts have finally borne some fruits. The number of AIDS-related deaths among children has since declined more than 60%. According to nurses practitioners, this is progress that can be sustained.
We have significantly reduced the infection rates of children from their mothers, and the mothers are living healthy, mothers are living longer, mothers are living well, and the children are born free of HIV.
Most of the mothers are adhering to the drugs, and even the viral load is well suppressed. So incidences of having babies infected has become low.
In the past, women in Kwale County gave birth at home with the help of a traditional birth attendant who typically had little or no formal healthcare training. This led to a high death rate of newborns and pregnant women. In search of a life-saving solution, nurses working in rural healthcare facilities recently launched a program whereby traditional birth attendants are enlisted and subsequently trained on the importance of giving birth at healthcare facilities under skilled personnel. As a result, a rebirth of traditional birth attendants has been witnessed. Siuliza Omar is a former traditional birth attendant at Tiwi Sub-County.
Unamshauri, wataka Msambweni, wataka Diani, wataka Tiwi, peleke hapo Tiwi Rulo, tunamleta kila mmoja. Yani mimi na kijiji changu, kuna kijiji cha Pongwe, kuna kijiji cha Chai. Sasa village yote tunaungana, kila mmoja na pahali pake na kila mmoja na rafiki yake.
So far, over 100 former traditional birth attendants have been trained and linked to the country's healthcare system. They currently cover over 50 villages under the supervision of the county's nurses. Their new role?
Tuliletwa hapa, tulikuwa kila wakati tunawasha ndogo ndogo, tukailimishwa na madaktari, na sisi tukifika kule nyanjani tunazungumza na wale wakina mama vizuri mpaka wanasikia.
Since the program was launched, healthcare centers continue to receive hundreds of visits from women and newborns referred to them by the traditional birth attendants.
We have such education sessions whereby we normally tell them what is expected. This mother is expected to produce milk for the baby, breast milk. This mother is expected to provide warmth. This mother is expected to learn or to report any eventualities. There are events which occur immediately after delivery.
After giving the children the immunization, we let them know that this immunization we are giving them, it is very important to the children, and in case that child has any side effects, like maybe there's a swelling at the injection site or the child develops a fever, they are supposed to bring that child to the facility back to us so that we assess the condition of the baby.
As stated by nurses, partnering with the former traditional birth attendants to raise awareness on the dangers of home deliveries is undoubtedly making a difference.
We tell them, they go back to the community, they explain the importance of giving back to the hospital, and at least it has helped a lot.
Looking at Siulize, she seems to have embraced her new role with gusto, and since the traditional birth attendants are prominent community members, the women in the villages tend to readily heed her advice.
Lakini bado sisi tuko wa nyumbani, anatufata. Akija pale kama mama, mimi sijui nasikia nini, nasikia, namwambia mama, hivi sasa tuende hospitali, ukaangaliwa, utazalishwa vizuri.
With the support of nurses, today's new mothers are highly engaged and are making educated decisions at their total healthcare needs. They are focused in their search for nearby healthcare facilities known for quality care and safety. It is this setting that registered nurses in Kwale stand out as having publicly demonstrated their competencies.
The nurses have been a very vital instrument, especially in ensuring that the deliveries have improved.
The figures have improved compared to the previous years. Before the free maternity, the figure was low, but now at least the figure has improved a lot.
Healthcare facilities which have so far been recognized for nursing excellence are said to have much better outcomes for very low birth rate infants. One such facility is the maternity wing for the Likoni Sub-County Hospital.
The main reason why we decided to support the sub-county with the maternity basically is to reduce the rate of referrals, hospital referrals to the Coast General, which again was getting high numbers from other counties, not only Mombasa County, since it served the whole region. So we decided it was a hassle for pregnant mothers, especially for the ferry, to cross. So we supported them with the facility, which is a maternity, and we've seen quite a positive change.
Over the years, matters pertaining to maternal and child health care have been considered a reserve for women. However, a group of men is slowly changing this narrative. This is through attending educational forums convened by nurses in some of the rural healthcare facilities where they are equipped with the necessary facet and skilled to help promote maternal health care. In a rare display, Juma Wambua from Kibuyoni Sub-County accompanies his wife to the dispensary for the postnatal clinics.
Sahi hata nimemregesha na nafurahia kuandamana na bibi yangu tukija kliniki. Na nahimiza wanaume wale wengine nao pia wafanye kama vile ninavyofanya mimi, tuwahudumie mabibi zetu.
Wambua, who has been attending the sessions, is proud of taking a leading role in determining the health of his family and sensitizing other men on the importance of being champions of maternal and child health in the community.
Changamoto nyingi sana wanaume wengi wapendi kutembea na mabibi zao. Hospitali yote kwa jumla utakuta wanawake ndio wamejaa hospitalini, wanaume hakuna. Sasa mimi kile naweza changia kwa wanaume wenzangu wajifundishe pia kuja na mabibi kliniki, ndio pia waendelee na kusoma mambo tofauti.
Nurses say involving men in promoting the health of women and children has been instrumental in stemming maternal and neonatal deaths.
Actually, we've seen health. Without involving the man, we cannot reach anywhere. So we bring the man on board when they've turned up around. We talk with them specifically by appreciating them. That being escorting their women, their wives to the healthcare facility or to an outreach, this is very positive because of that moral support, especially to the pregnant women during their journey as they are carrying that baby to term and delivery.
Accessing health services has also been extremely difficult for the rural population in Kwale County due to limited means. Paying for prescriptions and accessing transportation has been quite challenging for most locals. In response, nurses are reaching out to communities that have the greatest need.
Mwaloya is a village within Kinondo ward, and it's served by Magaoni Health Center. It's quite a distance. We feel that it's wise that we need to bring the services down to the community. That's why we are here for our Health Action Day.
The socio-economic status of our community is a bit low. We saw the need to bring the services nearer to their clients so that they can have this day with us, they can talk with us, we can sensitize them, we ask They ask questions, we clarify their fears about health, and also we market ourselves, what the nurse actually does.
Clinics and outreach programs are set up in communities where clients live and congregate. The outreach programs comprise of HIV testing, cancer screening and awareness programs, and crisis control, which entails nurses volunteering to help with jiggers eradication and community immunization programs.
When we come down like this, the community really appreciate. They can share or get access to all the services we brought on board.
During outreach programs such as the Health Action Day, the nurses usually partner with different organizations to offer support to their communities. These partners include the Kwale County government and the Best Titanium, amongst others.
The nurses have been very supportive to not only to the partner but to the county. They ensure that services are brought down to the community.
Nurses and midwives remain key to achieving universal health coverage in Kenya. They have so far managed to spearhead primary health care and advance the quality of services in many rural or remote communities around the country. This notwithstanding, the profession's leadership is strongly convinced that the government could do more to motivate the nurses.
Universal health coverage and access is not just about accessing any care. It is about offering quality service. We want to walk this journey of access and achieving universal health coverage together with our government.
But which factors do nurses consider to be indicators of pleasure in their day-to-day undertaking?
When I see somebody suffering, and like let's say a patient, and I see that this person I have attended to him or her, or this mother I've assisted her in labor, and she has come out, during pregnancy, I've been with her pregnancy, labor, delivery, and she has come out successfully and healthy. I feel proud of myself.
What gives nurses happiness is having to walk with patients along the recuperation journey as they can, be it at home, in the community, in the ward, or even in the outpatient clinics.
And here is their plea to the government.
The government should look into the nurses' challenges, not just brushing them off, just putting them away. They should listen to them. They should come to the ground and see what we usually do and the different specialties that nurses have taken.
Treat nurses in a human way, motivate them. In so doing, there will be smooth operation in the hospital.
I think they should come down to the ground and see what really the nurse does.
Very few of us as nurses sit at policy making decision levels. As government sits, as policies are made, it is our desire that nurses would be given an inclusion and especially to have many key roles to play at the policy making table.
Still, more professional bodies continue to support nurses and advance the nursing profession. They too serve as advocacy groups for the profession. One such outfit is the Kenya Progressive Nurses Association. Nurse Triza Ireri is the association's national secretary.
Many times, Kenya Progressive Nurses Association have involved ourselves with activities that involve conditions that are normally neglected, that are normally not attended to in the day-to-day activities in the hospitals. For instance, one of our key flagship projects, what that we do, is the reconstructive of cleft lip and cleft palate. This is the time every year, once in a year, we go out to community and we give our skills, our knowledge, together with other health workers to reduce the number of clients with this condition.
On May 12, countries around the world come together to celebrate International Nurses Day. With the celebrations currently underway, here is what the Kenyan nurses hope to achieve.
Majorly, as a professional body, whose core mandate is professional development and social welfare for nurses. We are going to be bringing our voice to celebrate and uplift the profile of nurses in this country and also raise the status of nurses in this country.
I, as a nurse, wish to see is people being sensitized about what is the role of a nurse.
Let's do what pertains to us, and then let's always demand our rights and what belongs to us.
And they should appreciate us because we are really working hard. There are times even we forget about our families.
According to numerous national reports, nurses will play a critical and dominant role in the future of healthcare delivery, a challenge that the country's registered nurses seem prepared to embrace and are confident that their patients will indeed reap the benefits.